Ako, para akong unggoy.
That's right!
DJ yun Hello guys! Welcome to One Course Channel. For today's episode is about 4 techniques of collecting objective data. So for the first one is inspection. So inspection involves using the senses of vision, smell, and hearing to observe and detect any normal or abnormal findings.
Use the following guidelines as you practice the technique of inspection. The first one is to make sure the room is a comfortable temperature.
Good morning, Ma'am. I am Janela Ramos, your nurse for today, and I am in charge in inspecting you from head to toe.
A too cold or too hot room can alter the normal behavior of the client and the appearance of the client's skin. Second one is to use good lighting, preferably sunlight. Next one is to look and observe before touching. Touch can alter appearance and distract you from a complete focus observation. Next is to completely expose the body part you are inspecting while draping the rest of the client as appropriate. And then note the following characteristics while inspecting the client: color, patterns, size, location, consistency, symmetry, movement, behavior, odors, or sounds. And then compare the appearance of symmetric body parts or both sides of any individual body part.
So for the second one is palpation. Palpation consists of using parts of the hands to touch and feel.
Palpate for texture, temperature, moisture, mobility, consistency, strength of pulses, size, shape, and degree of tenderness.
Good morning, Ma'am. I'm Janelle Joy Pagdilaw, your nurse for today, and I will be going to palpate you in a cephalocaudal way.
By manual palpation, use 2 hands, placing one on each side of the body part being palpated. Use one hand to apply pressure and the other hand to feel the structure. Note the size, shape, consistency, and mobility of structure you palpate. Light palpation. To perform light palpation, place your dominant hand lightly on the surface of the structure. There should be very little or no depression. Feel the surface structure using a circular motion. Use this technique to feel for pulses, tenderness, surface skin texture, temperature, and moisture.
So we're going to discuss the percussion. So what is percussion? It involves the tapping of body parts to produce sound waves.
3 types of percussion are direct, blunt, and indirect percussion.
Hi, Ma'am. I'm Erica May Salazar, and I'm your nurse for today. So what I'm going to do now is I'm going to percuss your sinuses.
Direct percussion is the direct tapping of a body part with 1 or 2 fingertips to elicit possible tenderness.
And next, Ma'am, I'm going to percuss your kidney, which is called blunt percussion.
Blunt percussion used to detect tenderness over organs. Example is kidney. By placing one hand flat on the body surface and using the fist of the other hand to strike the back of the hand flat on the body surface. Indirect or mediate percussion is the most commonly used method of percussion. The tapping done with this type of percussion produces a sound or tone that varies with the density of underlying structures. As density increases, the sound of the tone becomes quieter.
So the final technique is auscultation. It requires the use of stethoscope to listen the heart sound, body sound, the movement of bowel, the movement of air through respiratory system, and the movement of blood through cardiovascular system.
A stethoscope is used because these body sounds are not audible to the human ear. The sounds detected using auscultation are classified according to the intensity, pitch, duration, and quality of the sound.
So for abdomen, we are going to use the four techniques in collecting objective data.
Inspection. Much information can be gathered from simply watching the patient and looking at the abdomen. This requires complete exposure of the region in question, which is accomplished as follows. First, ask the patient to lie on a level examination table that is at a comfortable height for both of you.
Sir, I'm going now to auscultate your abdomen.
Auscultation of the abdomen has a relatively minor role. It is performed before percussion or palpation. Exam is made by gently placing the pre-warmed diaphragm on the abdomen and listening for 15 or 20 seconds. There is no magic time frame. The stethoscope can be placed over any area of the abdomen as there is no true compartmentalization, and sounds produced in one area can probably be heard throughout.
Sir, I'm going now to percuss your abdomen.
First, remember to rub your hands together and warm them up before placing them on the patient. Then, place your left hand firmly against the abdominal wall, such that only your middle finger is resting on the skin. Strike the distal interphalangeal joint for your left middle finger 2 or 3 times with the tip of your right middle finger using the previously described floppy wrist action.
Sir, I'm going now to palpate your abdomen.
First, warm your hands by rubbing them together before placing them on the patient. The pads and tips of the index, middle, and ring fingers are the examining surfaces used to locate the edges of the liver and spleen, as well as the deeper structures. You may use either your right hand alone or both hands, with the left resting on top of the right. Apply slow, steady pressure, avoiding any rapid or sharp movements that are likely to startle the patient or cause discomfort.
So for the summary of 4 techniques for collecting objective data,
Collecting objective data is essential for a complete nursing assessment. The nurse must have knowledge and skill in 3 basic areas to become proficient in collecting objective data: necessary equipment and how to use it, preparing the setting, oneself, and the client for the examination, and how to perform the 4 basic assessment techniques. Collecting objective data requires a great deal of practice to become proficient. Proficiency is needed because how the data are collected can affect the accuracy of the information elicited.
so that's all for today's episode in One Course TV. I hope you learned something, and don't forget to like, share, and subscribe. Bye!